For Salmonella, we have 5 topics: Salmonella of swine, fowl typhoid, fowl paratyphoid, Salmonella of cattle, and Salmonella of small ruminants and horses. Salmonella diseases are often referred to as typhoid. This is because in historical times, Salmonella made people delirious. And typhus is the ancient Greek word for smoky, and it was used to refer to people's delusional, smoky mental states. The bacteria causing these typhus diseases was then named after Daniel Salmon. So first we need to do a very quick overview of the etiology. Salmonella is a part of the same family as E. coli, Enterobacteriaceae. It is a gram-negative rod, it is not spore-forming, and it's not fastidious. This means it can grow on many different cultures, and it has medium resistance, but it has good resistance in the environment. Scientists used to think that there were multiple species of Salmonella. However, it's discovered now that there are only 2 species of Salmonella, Salmonella enterica and Salmonella bongori. Salmonella enterica is the only one important to vets. It has 6 subspecies: Salmonella enterica enterica, which is found in mammals and birds, and Salmonella enterica arizonae, which is found in birds and reptiles. The rest are irrelevant. Salmonella enterica enterica has many serovars, also known as serotypes. So for example, we can have Salmonella enterica enterica typhimurium, where the enterica is a species, and then enterica is a subspecies, and typhimurium is a serovar. But for short, we can also just say Salmonella typhimurium, which coincidentally was also the old name. So for Salmonella of swine, there are 3 diseases: swine typhoid, swine paratyphoid, and swine typhocolitis. Swine typhoid is caused by Salmonella typhusui. It used to be very common, but now it's rare. It's only found in pigs. It's an obligate pathogen, which means it does not need predisposing factors. It is a chronic disease and is found in grower pigs over 6 weeks old. Bacteria enters the body orally and then it spreads to the large intestines, and then it spreads to the lymph nodes, the lungs, the liver, and the spleen. Since it's a chronic disease, the clinical signs will appear slowly, and they'll get coughing and yellowy diarrhea. In the pathology, we can see ulcers in the large intestines, and there is no treatment. For swine paratyphoid, it is caused by Salmonella cholerae suis, typhimurium, and Darby. It occurs worldwide, and unlike swine typhoid, it is facultative and requires predisposing factors. Bacteria enters the body orally, and then it goes to the small intestines, and if there's predisposing factors, it'll spread to the lymph nodes, the lungs, the spleen, and it can cause cyanosis in acute phases, and in chronic phases, it can cause arteritis. The clinical signs are coughing and yellowy diarrhea, as well as limping. In the post-mortem, we see ulcers in the small intestine and sometimes the large intestine. For treatment, you can give polymyxin, fluoroquinolones, and aminoglycosides. And for prevention, remove the predisposing factors, and you can also vaccinate them after weaning, since it affects pigs 2.5 months of age. For swine typhocolitis, it is caused by Salmonella typhimurium and other serovars. Just like swine paratyphoid, it is facultative and requires predisposing factors. It mostly affects growers, and it can be zoonotic. In the clinical signs, we can see sometimes watery, yellowy diarrhea and sometimes bloody diarrhea. Unlike swine typhoid and swine paratyphoid, there are no ulcers in the large intestines. However, there is inflammation. And just like swine paratyphoid, for the treatment, give polymyxin, fluoroquinolones, and aminoglycosides, and control the predisposing factors. And also, control birds and rodents. For fowl typhoid, it is found in Asia and South America, and it's very common in backyard birds. It is a sporadic disease, and it's notifiable in Canada and the United States. However, it's not notifiable in Hungary, but you must report to the OIE. Salmonella pyllorum affects young birds, and Salmonella gallinarum affects adults. In some countries, these are seen as 2 different diseases, so we can have pyllorum disease and fowl typhoid. However, in Hungary, they're both just seen as fowl typhoid. This is because the main antigens are identical, but the OIE lists them as 2 different diseases. It's an obligate pathogen. Just for reference, fowl typhoid and swine typhoid are the only Salmonella diseases with obligate pathogens. The rest are all facultative. The susceptible animals are poultry, turkeys, wild birds, and ducks. It can spread horizontally and is also a germinative infection. Rodents, wild birds, as well as red mites contribute to the horizontal spread. The bacteria enters the body through the oral nasal route and then it spreads to the intestines. And then septicemia will spread the bacteria all over the body. In young chicks, they can have an unabsorbed yolk sac as well as white diarrhea and spread legs due to their enlarged liver. They will also have respiratory signs and arteritis in their wings. Many chicks will also not hatch because there will be an increased number of dead eggs. In adult birds, ruptures in the feather follicles will lead to peritonitis. This is the main symptom. The birds will also have white diarrhea and walk with a penguin-like posture. They'll have decreased egg production, as well as purulent arteritis and necrosis of the heart muscle. This disease has a long carriage, but you can treat it with tetracyclines, sulfonamides, and fluoroquinolones, and you can vaccinate them in endemic areas. For fowl paratyphoid, it is caused by the serotypes Enteritidis, Typhimurium, Infidus, Hadar, and Virchow. To remember these, just think of ETI, HV. These are facultative pathogens unlike fowl typhoid. They have long carriage in the gut. They spread horizontally through feces, rodents, and wild birds, and there's also a germinative infection, just like fowl typhoid. In young birds, they get septicemia like fowl typhoid, but in geese, they get conjunctivitis and incoordination, and weak legs. In adult birds, they're generally okay. However, in pigeons, they get CNS signs and arthritis, as well as diarrhea. In all birds, they have decreased egg production overall. To detect fowl typhoid and fowl paratyphoid, we can use PCR, ELISA, and agglutination. And for treatment, we can use fluoroquinolone. There are vaccines, inactivated and attenuated, for Salmonella enteritidis and Typhimurium. There is asymptomatic Salmonella carriage in breeders, layers, and broilers. Salmonella infantis is the most frequent. However, Salmonella enteritidis and Typhimurium are rare, but they're important because they're zoonotic. Salmonella has long carriage in the cecal and lymphoid tissues. This is why, for Salmonella, we need to test before slaughter, and we also need to have good kitchen hygiene. And for Salmonella reduction programs, in poultry breeders, we need to test for the 5 serotypes: Enteritidis, Typhimurium, Infantis, Hadar, and Virchow. We need to test the first 4 weeks of laying, in the middle of laying, and the last 8 weeks of laying. For commercial layers, and broilers and turkeys, we test for Enteritidis and Typhimurium. We test the Salmonella on 2 pairs of boot samples and dust. For layers, we test every 15 weeks, and for broilers and turkeys, we test 3 weeks before slaughter. For Salmonella in cattle, the serotypes are Enteritidis and Typhimurium, as well as Dublin, Newport, Montevideo, Agona, Derby, and Albany. It is facultative and requires predisposing factors. It can be endemic in calves aged 2 to 6 weeks old, and it's sporadic in adults. The bacteria can live in the environment, and a source of infection can be rodents, birds, and feces. The bacteria enters the body orally and it can replicate in the intestines, and then it can spread throughout the body and the blood. In acute cases, it causes watery bloody diarrhea, as well as dyspnea. And in chronic cases, it can cause abortion, mastitis, and arthritis, which will cause the cow to limp. It can be shed subclinically for 6 to 8 weeks. And for the treatment, give sulfonamides and fluoroquinolones, as well as rehydrate the animals. There are serospecific attenuated and inactivated vaccines for pregnant animals. And there are also oral vaccines for calves. The last topic is Salmonella in small ruminants and in horses. For Salmonella of small ruminants, we have generalized fever and abortion. Generalized fever is caused by Enteritidis, Typhimurium, Dublin, and Anatum. It is facultative and requires predisposing factors. In acute cases, we get watery foamy diarrhea. And in chronic cases, we get arthritis and sporadic abortion. In the pathology, we can see hemorrhages and inflammation in the spleen and small intestine. For abortion, in sheep it's caused by Salmonella abortus ovis, and it is more common in France and in China, and it occurs when there's cold conditions. It mostly enters the body through means of oral route. However, venereal can happen, but it's very rare. It then goes to the gut and then the fetus. We normally see abortion 2 to 4 weeks into the 3rd trimester, as well as retained fetal membrane and vaginal discharge. Rams are usually asymptomatic. And in aborted fetuses, in the pathology we can see autolysis, hemorrhages, and necrotic foci in the liver. The newborn lambs that don't get aborted, they usually get pneumonia, diarrhea, and then they will soon die. There is an inactivated vaccine for abortus ovis with chlamydia. For Salmonella in horses, there's an enteric form, full septicemia, and an abortion form. The enteric form, full septicemia, is caused by Salmonella typhimurium and Salmonella agona, which is also seen in cattle. It's facultative and requires predisposing factors. In the acute form, they get colic and diarrhea and die within 1 to 2 days. And in the chronic form, they get arthritis. There is no vaccine, just prevent the predisposing factors. In the abortion form, it's caused by Salmonella abortus equi, similar to abortus ovis in sheep. The predisposing factors are equine herpes virus 1 and mycotoxins. It usually causes abortion within 2 to 6 weeks of infection, and the abortions are most common in the 4th and 8th months of pregnancy. If the foal doesn't get aborted, they're usually very weak when they're born, and they die within 1 week. Before abortion occurs, we can usually see clinical signs in the mare, such as inflammation of the udder and vaginal discharge. And after abortion, we can see arthritis in the mare, as well as purulent metritis. There is no vaccination. Just isolate the mares and have good hygiene. And control rodents and keep them away from wild birds.